Hello everyone and welcome back to Flo's Corner. So today I'm going to be doing a highly requested video. This is a question that I always get from a lot of my viewers, and that is discussing the requisitions / orders for a blood draw. So please stay tuned. I just want to say just a little quick disclaimer. If you're working for a hospital as a phlebotomist for the actual hospital, then most of the time you're not going to be using requisitions and orders. You probably won't see anything of that nature because you're just a phlebotomist. Everything that's going to be when it comes to the orders is going to be going directly to the lab, and you as a phlebotomist will have, like I said, what your draws are going to be normally like on your little mobi phones that we have when I was a phlebotomist in the hospital. I've never seen a requisition or an order when I worked in the hospital. Whatever they needed to be drawn, whatever room and units and everything, it was just on the phone, and that's where you go. Anything with orders and stuff was not particularly with us as a phlebotomist. If you're working for a diagnostic center or laboratory, something like LabCorp or Quest, and you're working inside of the hospital, then you're more so on the third party aspect instead of just actually working directly with the hospital as their phlebotomist. So then you will probably see lab orders, requisitions, and things of that nature, because you're going to need these orders because you're working inside of the hospital, but as part of like the third party diagnostic laboratory. So then you will be using a lot of the orders. Just wanted to clear that up. If you're a phlebotomist working at a hospital, like I said, working directly in the hospital for them, then you're probably never going to see lab orders or requisition. You may, if you're training like to be in the back or anything like that, but just really much this is going to be like if you're working like in a clinic, if you're working for a diagnostic center, diagnostic laboratories, plasma centers, things like this, you may see more of requisitions and orders. So what is a lab requisition form, or some may call them test requisition forms? These are pretty much just documents that you are going to have handed to you, normally by the patient, by a provider, or something of that nature. Some of them are also e-filed as well. And this is going to have exactly the samples that you are going to collect from this certain patient that will be sent off to the laboratory for testing. So like how I always try to educate everyone about, we just don't draw blood samples. We have other samples that we do collect and handle. These are going to be on requisitions and orders that's going to tell you what you are going to take from this patient. So obviously, like I've always said, that is urine, that's part of blood. You can have tissue, you can have stool, you can have breath, you can have sputum, you can have all these different specimens that's going to be on a requisition / order. Requisitions are very, very important because they contain very important information that will allow the laboratory to process these certain samples and perform the requested tests that is ordered. Requisitions are used by healthcare professionals that are requesting laboratory testing. It is paperwork requesting specific tests and why it is needed. So just embed this in your brain. Any type of sample / specimen that is going to be sent to the lab must contain a requisition that is attached with it. No form, no testing. That is the critical part about being a phlebotomist that you cannot forget, and that's having this requisition / order going with this specimen. Whether it's from paperwork or whether it was an e-file, there has to be something leading to with this specimen, whether you have urine, whether you have stool, whatever. You need to have this requisition form with it so they know what testing has to be performed, and making sure that it's obviously the right patient and all the other stuff that leads down that way. So what does a requisition contain on it? Well, obviously the patient's info is definitely number one. So you're gonna have their full name, their date of birth, their gender. Some of them may contain an ID number for a patient. Requisitions will also contain the ordering physician's name, address, phone number, the provider who actually are requesting the test. Also, the requisition is going to have the test information. what specific test that needs to be performed will be on the requisition. Some requisitions will contain the insurance info of the patient. And then also, you will also have the sample info. So you'll pretty much have like the date and time the sample was collected and the type of sample that it was. Also on requisitions are going to be ICD codes. ICD codes is pretty much stands for International Classification of Diseases. So healthcare providers may be wanting to check something specific from their patients, and the ICD codes will put what the testing is normally for. ICD codes classifies and codes medical conditions like diseases, symptoms, procedures, things like these is why you need the ICD codes. We also call them diagnostic codes in the laboratory world. ICD codes are also used for billing, like the billing of insurance. It's also used for like treatments of like collecting statistics. Like there are certain people that do blood work or blood draws or give samples for statistical purposes. ICD codes are very important because they are assigned to diseases, and they're also very important for like reimbursement and like to help with treatments and things of that nature. So requisitions should have diagnostic codes on them as well. So normally when you are working in a clinic or a diagnostic center, then whenever a patient comes in, or even if you're working in the clinic and there's like the nurse or the MA to hand you an order or even send an e-file, you have to have a requisition and an order in place. A patient may come in and say, hey, my doctor told me to come here for labs, and I'm ready, I'm waiting, here we go, what are we gonna do? Okay, so obviously you ask, do they have an order with them? If they don't have a paper, well, they e-filed it. So then we do the same thing. Have you been here before? Most of the time when you're working at a diagnostic center, they may have gone to that same diagnostic center, not that location in particular, but they'll always be in the system forever. If they went to one or two, like I said in my other video, you can always check that out. I questioned, like, have you been here before? That's one of the first questions. If they have, then obviously they should be already in the system. You will normally write their name and their date of birth in the field, and then you'll press patient search, and it should bring them up. If not, then you're just going to add them as a new patient into the system, which only takes less than 5 minutes. So here is a requisition that I use at my job. I hid some of the parts for my job's confidentiality, but this is what the clinic hands over to me. Normally, it is filled out with the patient's information, the type of testing that they're looking for, so that lets me know what I'm going to be performing, collecting, and handling. So here I'm going to zoom in a little closer. Right at the top is going to be all of the patient's information. In certain circumstances, the requisition may have the insurance part filled out, but if not, if you have the patient come in, like I said, you're going to ask for the insurance card anyways. Just make sure that you send that with the requisition when you make a copy. Here is where your ICD codes are going to go. Make sure that that is filled in properly by the doctor. If not, if you don't see any of the diagnostic codes on there, then you're going to have to call the ordering physician's clinic. Next, you're going to have all of your testing. You're going to see all of these different numbers by it. That's just from where you are working. These are the certain test codes that we have. It may not be the same for every place of work that you work at, but it's good to get frequent with them. And those are going to be checked off as well, because this is what the physicians are going to be checking off on what they want to find out about their patients. So for the company I work at, we use another system called Atlas, and pretty much when we get our requisitions, we are just going to enter it into our information. This is how we do our laboratory testing that is sent over to the lab, and everything is just computer wise. So pretty much like here, when I said we got a patient, normally in the top box where it says patient, you will enter their name if they've been there before. If not, you're just going to press the level on the bottom that says new patient. Now here you can see it says account, insurance, Medicaid, Medicare, or patient, which is normally self-pay. So for demonstration purposes, I'm just going to use account, which is going to be billed normally to the physician, but this is just demonstration, so it's not going to be billing anyone. So if the patient has already been to our diagnostic laboratory before, then all of these fields will already be in the system, and all you would do is just verify that all the information is still correct and up to date. But if you have a new patient, like here, I'm just going to write both of my names twice, and the last name and first name. You're going to write the date of birth on there. No, this is not my true date of birth. It is my month and my day, but it is not my year. So ours go by 2-number month, 2-number day, and 4-number year. Then you're going to write their gender. Just press the little drop box, and then it'll come down and you just choose. Then you're going to move over to the right, and here the highlighted fields is going to be the address, the city, the zip code, and the telephone number. Anything highlighted must be put in the system. If not, it won't let you go to the next screen. All the other fields, it's optional whether you want to add more information about the patient on there, but it is not mandatory. Here I just added a random zip code. When I put in the zip code, it already put up the city that it is in. I'm just adding just some random address, and then you're going to add the telephone number as well. So you're going to do all of this while the patient is in the room or right in front of you. You're going to ask them for their ID so that you can verify all of their information is correct. Once you are finished, you're just going to press that bottom lever that says save, and then you are going to press on the new order. And just once again, this is only for when you have a new patient. If you already have a patient that's already been there, then everything will be the same. All you will be doing is just verifying. Here it's just going to ask the question if the patient is fasting. It's going to have the date and time that you're doing this order. The specimen collector obviously is going to be yourself. So you just put your initials there. Then you have these little boxes that say clinical info and order notes. That's just anything you want to add into the notes, like if the requisition was e-filed or if anything specific to the order, you will put them in the clinical info or the order notes. On the left side of the screen, it's going to have the order number, and then you're going to click down on the ordering physician. Normally, if it's already in the system, it would have the ordering physician there. You just want to make sure that it's verified and correct. Then you're going to click next, and on the next screen it's going to tell you to type in the test code. So here you're going to write the test codes that's normally going to be on the requisition. So like for this one, this requisition have for an RPR and a quantiferon. So I'm just going to put the test codes, and you're going to see them drop to the bottom. Then you are going to press continue on the right hand side, and then it's going to take you to the ICD codes part. Now, normally when you had a patient that had an e-file order, then most of the time the ICD codes will already be checked off, which would be fine. You would just have to verify it. So you will enter those codes the same as you did your test codes, and then you're going to press continue, and then it's going to bring up your screen, and now your labels is going to come out. After our labels come out, then we normally get another type of requisition, and this is just for my company in particular. And this one is going to have the same thing, the same information, and this one is just personally for our company in particular. So this is going to be sent off at the end of the night as well with the regular doctor ordering requisition. Yeah, so I really hope that was a little bit clear. I just wanted to go into how I do the requisitions for the certain company that I work for. I didn't want to go into the medical insurance information and things. That's going to be also on your requisitions as well, and adding them into the system if you use a system like Atlas like we do at my company. But you know, like I said, I didn't want to just really get into the video and all that crazy stuff. But I really hope that was helpful. Definitely, as a phlebotomist, just some words of encouragement is that don't ever feel that the requisitions is anything hard to understand. Honestly, you are going to be trained. Like, you are literally going to be trained when you're going to start getting orders and how to not fill them out, because you're not personally filling them out, but how to determine what is what, how to put it in the system, how to look at it in the way that you're supposed to as a phlebotomist, and then know what to do after that. You will be trained on everything when it comes to that. And also, you're going to be trained on how to do the insurance and billing information as well. Jobs will never throw you on diagnostic center or diagnostic laboratories or clinics and you don't have any training on what to do, because every place is different. So just because I show you guys this way of how we do requisitions and add it into the system in this sort of way, doesn't mean that you will do that somewhere else the same exact way. It may be similar, but it may be different as well. Always remember, like I said, no requisition, no order, then no sample, no testing, no specimen collection, no nothing, because you need to have a paper trail. Always remember that in your phlebotomy career. I don't care where you're working. Don't have anyone just drop off something. Oh, hey, this is a urine sample. Hey, this is a stool sample. And it's just sitting there. You're like, okay, well, that's great. It's sitting there, but I need orders for this. Like, we're not just going to just have this here and I got to make up on my mind of what is going to be tested on this certain sample. So always make sure of that, because you never want to send something to the laboratory because it's going to come back on you as the phlebotomist, because you work for the laboratory company, not the other person who dropped off this certain specimen. So always have your back covered. Specimen, have an order with it. Requisition, where is it at? Give it to me. But I really hope that this video was helpful. Like I said, definitely check out my playlist. I have all of my phlebotomy videos all in one playlist if you just want to just binge watch on the phlebotomy videos to learn anything that I am trying to teach you guys. Really hope that this was very helpful. You got this. If you're new to phlebotomy, welcome. If you just deciding you're not sure on what you want to do, come on over. We need you, baby. We need you, okay? And if you have any questions, comments, concerns, please add that down in the description box below. Please give this video a like. I would really truly appreciate that, you guys, and I hope to see you all in my next video. Bye.